Hi, David Rosenberg here for the Psychopharmacology Institute. In this CAP, or Child and Adolescent Psychiatry Smart Take, we'll examine if there are side effects that can reliably predict psychotropic medication non-adherence in adolescents and young adults with ADHD. Now, obviously, this is a critical concern because you can have the best medicine or treatment in the world, but if your patients aren't taking it, how's it going to help? But teasing apart and identifying side effects, making sure they're reported, and what side effects best predict non-adherence, that's challenging. Is it the total number of side effects, their severity, or any particular side effects? What this article does so well is it takes a deep dive and makes a careful analysis to identify predictors or lack thereof for psychotropic medication non-adherence in adolescents and young adults with ADHD. So what are the take-home points from this analysis? Well, first of all, perhaps not surprisingly, lots of ADHD patients report at least one side effect, almost 80%. But the real clinical relevance and pearls in this study found that upset stomach and vomiting significantly predicted psychotropic medication non-adherence in adolescents and young adults with ADHD. And one part of this study to take particular note of is that it used a comprehensive list of 35 possible side effects as well as an other option. And one advantages of this approach is that it's not relying solely on the person's recall for side effects and adverse events, their memory. Now, that being said, the approach of just having a list for patients to fill out is not one that I would recommend, and it's not likely to be sufficient. And the best strategy is to couple a comprehensive list like this with open-ended questions by the clinician. The point being that clinicians can't just decide, I'm going to save time and hand out a list of side effects and hope that all the possible side effects are covered and filled out. We all know that some may do this well, but others are going to rush to fill out a list without taking a lot of time, and their goal of completing the paperwork fast may override the comprehensiveness of the report. Others might even wonder if the clinician is actually going to review the paperwork. So the best approach is a combination of a comprehensive list, going over the list with the patient, and also asking open-ended questions about side effects and adverse events to elicit as much information as possible. And this may also instruct the patient, the family, and others how important you take this and your interest in knowing about side effects, adverse events, anything that will help in the patient's treatment. Time and time again, the doctor-patient relationship has been demonstrated to be so critical in treatment adherence or lack thereof. And it makes sense, right? If your patient doesn't feel comfortable with you, is afraid of disappointing you, doesn't feel comfortable opening up to you, how likely is the patient to discuss non-adherence, side effects, and particularly side effects the patient may find embarrassing or unsettling? Another thing that was interesting in this particular study was that the side effects were patient-reported. The authors of this paper note that parents of children with ADHD have been shown to not be optimal reporters about medication side effects, and they often don't ask about side effects. That being said, I wouldn't recommend just relying on patient report and not involving the parents, the caregivers, the family member, or spouse. More information is always better, and getting as much information as possible is vital. I also think that by asking parents and family members, this can underscore to them how important it is for them to alert and ask patients about possible side effects. So they're alert, so they're involved and engaged in recognizing how important you consider this. So this article has real relevance to clinicians in the trenches, especially since there have been reports that managing and or minimizing adverse events can be every bit as important as symptom reduction in achieving optimal outcomes for patients. In the case of adolescents and young adults with ADHD, first, it's important to be on the lookout for any and all side effects, particularly upset stomach and vomiting, given its predictive ability for non-adherence. And if these occur, it may be worth considering alternative medication, given the high rate of discontinuation, and or being on the lookout for this at the get-go, addressing it head on with the patient and family, as well as looking into potential contributing factors, those related or unrelated to the medication, or where there might be interventions that can minimize or eliminate these effects. And finally, evaluating whether the effects are likely to be transient or long-standing. So definitely an exciting area. This is ready for prime time, but more research is needed looking at specific medicines, their predictive value, risk of non-adherence, as well as with non-medication therapies. But this is an important lead and well worth your reading.